Actual schedule has not been yet out, sir, but exam is scheduled from May 15th. Theory. Okay, okay. So Viva will be after that, right? So what we are planning to do, Dr. Matthew, Dr. Anu, is that we are planning to actual schedule every day has not been yet out, sir, but exam is scheduled around 10 from May 15th. Theory. Okay, okay. So Viva will be after that, right? So what we are planning to do, Dr. Matthew, Dr. Anu, is that we are planning to actual and so what we will do is and then we will go for the Viva. So we'll plan it in 3 stages. Now for another 10-15 days, I'll be doing a lot of topics which have been asked in the exam papers, and this is all purely directed to MS exams. So if a consultant is going to watch us, he may get bored. I'm already telling you, this is purely for exam going PGs. So that is my plan, and I hope that the exam going PGs will enjoy these sessions. And then we'll have
Oh, oh man, sorry about that, folks. Getting back.
you can read the whole day, and this half an hour you can spend with us, so that it will be useful for you. So actual schedule has not yet been out, so but exam is scheduled from May 15th. Theory. Okay. Right. So we have around a lot of people who have joined. Pankaj has joined, Rajeshwari, and yeah, 15th theory. Okay. So we have around a lot of people who have joined. Pankaj has joined, Rajeshwari, and yeah. So just want to tell you that tomorrow we have coffee with John K episode 2, and that will be on facial nerve. So that's going to be complete course of the facial nerve, and that's a very important question which has been asked every year. Almost every other year you have been asked that question. So we will be discussing the the facial nerve tomorrow. And the day after tomorrow, I don't think we might have live, because I'm going to operate on an acoustic neuroma. So, and then on Friday, we have an olfactory groove meningioma. So, every night I'm operating, so we may not have the episodes on Wednesday and Friday. Apart from that, we'll have the episodes. So, what we are planning is we are going to discuss around 10 years question paper, MS question paper, both the basic and also the clinical, and then we're going for the Viva, the grand rounds, and we will discuss a lot of questions which can be asked by the examiners with respect to the clinical scenario, and we will actually present, our fellows will present from our own center, because it's becoming difficult to ask the companies to go to the particular place to make them do it. So we decided we'll do it from our own center. Our fellows who are here, we have around 6 or 7 fellows. So they'll present to me, and I will keep asking questions, and I think that'll be easier, and we'll have a huge question bank. So I just want to also tell you that we'll start this live program in another 5 minutes, and for those, most examiners, the old-time examiners, my age, and also, the slightly older people, I think the questions are from one book called Exam Point of View. I don't know if you are aware of this book. This book has been written by Professor Gananathan, and if you can get hold of that book, please read that book. It's actually exam point of view, and there are so many questions in that. It's a big question bank. In fact, when I went to my MS exam, my batch and also my, a few of my junior batches, we all read that book only before going to Viva. So it's actually called exam point of view. I'll try to share that PDF with you. I have that PDF, and those who want to get that PDF from me, you can give me email, and the email is T for Trichy, N for Narayanan, Janakiram, JANAKIRAM 777@gmail.com. So if you want the PDF of that book, I can share it with you. And people who are going for exams, who want to do their Viva, they can actually read that book. It's called Exam Point of View. So I think people who want to take their Viva. Okay. So let us see who have joined. Rajeshwari, then Shiva Balaji. Oh, Professor Anthony Francis is here. He's actually the encyclopedia of ENT. I really adore his knowledge in ENT. I think he's here. Dr. Anthony, Professor Anthony is from Madras Medical College, and he is my classmate as well. And I think he can also, I will try to bring him into one of the classrooms, and he can, I'm planning actually to do a temporal bone dissection with him. So complete temporal bone dissection, all the modules will be done for around 1 or 2 days. So I have a big plan. Let us see. And we have Shahil Abral, Sanjeev Yadav, Rajendra Gola, Arun Raj, Sabri Rajan, Ponusami, Ashwin Gajendran, of course my close friend Professor John Bennett from Miami, and he's internationally known figure, and he's also got the Neurosurgical TV, and he's televising this program also. Maybe he's doing that on his Zoom. And Matthew John Jackson is excited. A big thanks for this. Parul is Upadhyay is also there, and also Preetham has joined now. So these are all, I think, postgraduates. I'm not very sure whether they are postgraduates. So I think let's get started. We have already the clock has struck 9. So you're going to be with me only for half an hour. Dr. Kumar Gaurav, Preetham, Dr. Oli Ali, Hima Hashini, Deepak Pulwani, so many are joining. They're actually pouring in, so many. I'm so happy that this program is going to start off from today. And Harshita is there, and we're going to have a beautiful evening with all of you. Let us now get started. Now, the program was named Coffee with Janki because it's an electronic coffee. It's not like coffee with Karan or anybody. It's just like, it's an academic endeavor, and we're starting episode 1 today. And this is purely for the sake of postgraduates and not for, consultants, senior consultants. It's going to be very basic. It's going to be discussing a lot of basic stuff. And I thought I'll be of some help to all of you when I do that. Okay, going to this slide. So this is what is going to be discussed in the coming week. So you see here, these are all exam papers. You can actually have a look at it. So you can see that I collected this from Dinesh Kumar. I can also pass on his number to you. He is actually a very close friend of mine, and so you can write down his number if you want. He has got a question bank of several years, so you can write down his number +91 9620 928 650. So +91 9620 928 650. His name is Dinesh Kumar, and he has got a huge collection of all the exam question papers. And in fact, he shared this with me, and you can see here that the questions in the basic Okay, in the basic, you can see that this has been repeatedly asked, intratemporal part of the facial nerve. This is actually the anatomy question paper. And then the Walde's ring is going on being asked. And then the anatomy of fossa of Rosenmuller. And of course, the nasopharyngeal anatomy, recurrent laryngeal nerve, then intratemporal facial nerve course. So facial nerve is almost every 2 or 3 years it gets repeated. So tomorrow's topic will be facial nerve. So we are planning to discuss facial nerve, the surgical anatomy of internal acoustic meatus, internal aortic canal, and mention its contents. And then first we will be dealing with anatomy, and then we'll go to physiology of deglutition. You see physiology of deglutition, then mechanism of hearing is being discussed, and of course components of the lower esophageal sphincter. See all these questions. So just try to go through anatomy of the external aortic canal and the pinna, explain the development and anomalies. So we have tomorrow we're going to discuss facial nerve, and Wednesday is a holiday. We will have Thursday, we'll have Walde's ring, and then Friday again I'm doing a big case, so I may not be able to join with you. So we're going to discuss pharyngeal arches. So that is what I'm going to discuss. And then we'll be having ganglions and ENT, and all the exam questions. I'm going to paraglottic space, pre-epiglottic space, and anatomy of the larynx and things like that. So pterygopalatine fossa, all these are exam questions for you, and I will try to cover all these questions for you before maybe the end of this month. So I'm going to have 10 different papers. So, and I have now a big collection of all the exam question papers for you, and we will try to discuss all these questions. No, these are just a sample of 2012, 2011, 2010, but I have the complete list of exam papers. Now today's topic is going to be mandibular nerve. So this is a theory question. I think it's a short notes for you, and so we have this topic which is going to be discussed today in our coffee with Janki. So here we are. So let's get started with this. Suppose you ask this question. I think whenever you write, I just want to advise the postgraduates, don't write a lot of stories. I think stories are not what they.
Sure. Sorry about that, folks. Production difficulties. Oh man, oh man. Don't do any work on. Hold on, folks. I'll get back.
Question, what is the nerve of the first branchial arch? So the answer would be the mandibular division of the trigeminal nerve. So it supplies all the structures derived from the mandibular or the first branchial arch. So this is going to be your first introduction to mandibular nerve, and the course and the relationship. So put a lot of headings when you write. So my email, I'm going to type my email. There are a lot of queries. TNGANAKIRAM 777@gmail.com. So that's going to be my email. I can send you the electronic copy of the book, Exam Point of View, written by Professor Grananathan. He is my teacher, my professor. I owe a lot to him. Okay, now coming to the course and relations. Mandibular nerve begins in the middle cranial fossa. A large sensory root arises from the trigeminal ganglion and leaves the cranial cavity through the foramen ovale. So this is another exam viva question, which if I go would definitely ask, what are the structures passing through the foramen ovale? So the answer is male. It's called male. So male is nothing but the mandibular division of trigeminal nerve, the axillary meningeal artery, and then the lesser superficial petrosal nerve and the emissary vein. So now the course would be the motor root lies deep to the trigeminal ganglion and to the sensory root. So the motor root, it has got a motor root and a sensory root, and passes through the foramen ovale to join the sensory root, forming the main trunk. So there are two roots and they join to form the main trunk. And the main trunk lies in the infratemporal fossa over the tensor veli palatini, deep to the lateral pterygoid. So it lies on the TVP muscle and it is deep to the lateral pterygoid muscle and divides into a small anterior trunk and a large posterior trunk. So the sensory and the motor roots join, and then it lies, the main trunk lies in the infratemporal fossa. It divides into an anterior trunk and a posterior trunk. So so what are the branches? So if they ask you what are the branches of the mandibular nerve, in fact, if I am the examiner, I will definitely ask you mandibular nerve. That is why I made it as the first episode, because mandibular nerve is a very, very important nerve. And whenever we do a JNA, whenever we do an infratemporal fossa, this is the nerve you're going to face, and most of the branches you can actually trace. So from the main trunk, so what are the branches of the main trunk? There are the meningeal branch of the main trunk and the nerve to medial pterygoid, nerve to the medial pterygoid. So this is most important. So the meningeal branch is the branch of the main trunk. The second is the nerve to the medial pterygoid muscle. And from the anterior trunk, so you have to answer like that if somebody asks you in your Viva. So I have already typed the email ID. You can see it, Dr. Prashant. You can see it there. Now you have to say the main trunk gives off two branches, the meningeal branch and the nerve to medial pterygoid muscle. So so there is an anterior trunk and a posterior trunk. All the branches of the anterior trunk are motor except the buccal nerve. This is very, very important. All the branches of the anterior trunk are motor nerves except the buccal nerve, which is a sensory nerve. So the same way, all the branches of the posterior trunk are sensory except one nerve, which is the motor branch to the nerve to the mylohyoid and also anterior belly of digastric. So that is through the inferior alveolar nerve. So that is what you're going to say. You can see that's a branch. So if you want, you can draw this. Of course, there are some people who are good at drawing. It's always better to have illustrations. So you can have a one branch, so which is the main trunk, and then you can draw the anterior branch and the posterior branch. So I remember this like what is called the blia. So that is the mnemonic which I always remember. When I used to study during my MS degree exams, I used to remember that the anterior trunk has got three branches, that is three motor, temporalis, masseter and lateral pterygoid, and then we have the blia. Blia is buccal, lingual, inferior alveolar and auriculotemporal. So this is how I used to remember. It's called BLIA, blia. So that is just to make you remember that. So you can see that this is actually again pictorial representation. This is taken from the book Chaurasia, and I really love that book. And now let us go on to each and every branch. The meningeal branch or the nervus spinosus. So you can have a short notes, write a short notes on nervus spinosus. It is nothing but the meningeal branch of the trigeminal, the mandibular division of trigeminal nerve. Meningeal branch enters the skull through the foramen spinosum. So the foramen spinosum transmits the meningeal branch of the, that's the nervus spinosus also along with the middle meningeal artery. So they will ask you, what are the structures transmitted by the foramen spinosum? The answer would be middle meningeal artery and the meningeal branch, the nervus spinosus. And it supplies the dura mater of the middle cranial fossa. Now, nerve to the medial pterygoid, of course, this is again arises from the aortic ganglion and supplies the medial pterygoid muscle, the levator palati and the tensor tympani muscle. So the main trunk supplies three muscles. So what are the three muscles supplied by the main trunk? Medial pterygoid, tensor palati and tensor tympani. You should remember this very, very clearly. There are three muscles which are supplied by the main trunk of the mandibular division of trigeminal nerve. First is the medial pterygoid muscle, the tensor palatii and the tensor tympani. So it's the 2T and the M. So MTT, you remember it as MTT, main trunk, main M, trunk T. So it's called main MTT. So medial pterygoid, tensor palatii and tensor tympani. So it's so easy to remember like mnemonics. Now, coming to buccal nerve, it's the only sensory branch of the anterior division of the mandibular nerve and passes between the two heads of the lateral pterygoid and supplies the skin and mucous membrane related to the buccinator muscle. So actually, in fact, I used to dissect the buccal nerve. It's a beautiful nerve. We dissect it endoscopically. We can dissect it. If you look at the floor of the just behind the posterior wall of the maxillary sinus, you can actually beautifully trace that buccal nerve. It's a beautiful dissection you can do of the buccal nerve. Okay, of course, the mesenteric nerve. This is a very important nerve. Now it's gaining a lot of importance. They might actually now. If there is an examiner, he might ask you mesenteric nerve. The reason is because there is a very important applied anatomy for this. Emerges at the upper border of the lateral pterygoid, just in front of the temporomandibular joint. Just in front of the temporomandibular joint it arises, enters the deep surface of the masseter. But what is the anatomical or the clinical significance? This nerve is used now for reanimation of the facial nerve. So mesenteric nerve, mesenteric facial anastomosis is the in thing now, and in fact we have done a lot of dissections of the mesenteric nerve, and you can see that maybe I can do it once. It's a very simple dissection of the mesenteric nerve, and that is used now to anastomose with the facial nerve. It's called mesenteric facial anastomosis. Now the deep temporal nerves, two deep temporal nerves, anterior and posterior, they pass between the skull and the lateral pterygoid, enter the deep surface of the temporalis. Okay, now let us go to the nerve to the lateral pterygoid. It enters the deep surface of the muscle. It may be an independent branch or may arise in common with the buccal nerve. Of course, these are small points you have to mention, 1 or 2 points about when you are given a short notes on mandibular nerve, then you have to mention this. Auricular temporal nerve is a very nice nerve because it arises by two roots and it encircles the middle meningeal artery. If I am a YY examiner, I will ask you which of the branch engulfs an artery, and the answer to that is auricular temporal nerve. It engulfs the middle meningeal artery. It engulfs the middle meningeal artery and continues between the neck of the mandible and the sphenomandibular ligament above the maxillary artery, and the auricular part of the nerve supplies the skin of the tragus. So you know that we did you book. In fact, we'll discuss all that in the coming weeks, but this is very important clinical anatomy for you. Temporal part supplies the skin of the temple. Okay. Now going to the lingual nerve, one of the two terminal branches of the posterior division of the mandibular nerve, sensory to the anterior 2/3 of the tongue and to the floor of the mouth. So this will come during the submandibular dissection. Submandibular gland dissection, you will.
Damn. Sorry about that, folks. Once again, finding out why I should not work on Facebook while I'm televising live. Oh, man.
And now let us go to the inferior alveolar nerve. It runs lateral to the medial pterygoid and the sphenomandibular ligament, branches the mylohyoid branch, supplying the mylohyoid muscle, and of course the mental nerve, and also the anterior belly of digastric. So this is the only motor nerve of the posterior division of the mandibular division of the trigeminal nerve. So the muscle, mylohyoid muscle. So they will ask you, what is the nerve supply of the mylohyoid? Then you should say it is from the inferior alveolar nerve, which is a branch of the posterior division of the mandibular nerve, and that supplies the mylohyoid muscle and the anterior belly of the digastric. So of course it ends up in the mental nerve, and now you have to also deal with the clinical anatomy. The motor part of the mandibular nerve is tested clinically by asking the patient to clench the teeth feeling for contracting masseter and temporalis muscle on the two sides. So you have some diseases I can show you about masseteric hypertrophy, and also all that we will be discussing later. One masseter is paralyzed, the jaw deviates to the paralyzed side. And of course, pterygoid muscle is tested by asking the patient to move the chin from side to side. So the pterygoids are responsible for side to side movement of the chin. Referred pain, of course, the tongue lesions, pain radiates to the ear and over the distribution of the auriculotemporal nerve. And of course, the trigeminal neuralgia. This can again be a short notes for you. Trigeminal neuralgia. We'll discuss that in great detail in a different classroom. So the trigeminal neuralgia, the sensory root of the nerve is divided behind the ganglion. So we have phenol injections, you have division of the nerve, and of course now they say that the trigeminal neuralgia is always due to a vascular loop by the superior cerebellar artery, that's a scar. And of course we have surgeries which we can separate the scar from the main trunk of the mandibular nerve. Yesterday during my lecture I also showed a few, in fact a meningioma compressing on the mandibular nerve that can produce neuralgia. And so that is very important. Trigeminal neuralgia is going to be one of your questions. So this is what I wanted to discuss today, and that is the end of the lecture. It's just a half an hour program every day because I don't want to disturb the exam going PGs. They are reading very hard, I know, but I can contribute in some way by making some slides on the topics which are going to be asked. And so today we discussed about mandibular nerve. Tomorrow is going to be the facial nerve. So we will discuss all about the facial nerve, what you have to write in your lecture by me every day evening from 9 to 9:30. So now the time is around 9:30. I made this only for half an hour. So tomorrow we'll be back with you with the facial nerve, all about the facial nerve anatomy. It's just going to be the theory, discussion of theory and what you have to write. So if you just store all these videos, you just have to go, you can just go through these videos when you go for the exam. Thank you very much. Good night. Have a very nice week ahead. Thank you very much.
Hey, that's it. We'll stop this. This is the first of many webcasts. Naran will speak tomorrow on, as he said, the facial nerve. And so we'll stop this meeting now. Oh, no, I'll just stop recording. And we'll stop the